We're live. Thank you so much, everybody, for joining in. My name is Nick Parwal. I am part of the Lead Squad healthcare team, and I welcome everybody who've taken the time out today to join us for this absolutely amazing, interesting conversation that I'm looking forward to on leveraging patient data to drive better outcomes. We have an amazing panel that we've put together today, and I want to make sure that everybody here can get the most out of this conversation. So I again welcome everyone, welcome the panelists and everybody who's joining us for the webinar. Like I said, just a quick introduction again about myself. I have been with Lead Squad almost for 2 years. I currently am part of their healthcare division, where we're focusing on our growth in the healthcare industry in North America. And I would like to pass it on back to Jeffrey. Jeffrey, if you want to quickly introduce yourself, and then we can go around, just let the panel introduce themselves as well.
Great. Thank you, Nick. I appreciate the introduction, and I'm proud to be a part of this. My name is Jeff Kwame. I'm from Hartford, Connecticut. I am the executive director of the Connecticut Certification Board, which is a workforce development organization in Connecticut that focuses on building the workforce for individuals that care for folks with substance use disorders and mental health disorders. I'm a social worker by trade, but I also have a master's in organizational effectiveness and leadership, and I look forward to moving forward. So let's start with giving the panelists a chance to introduce themselves, and we'll start with who you see on your screen first. Mark.
Mark, you may be on mute.
Gotta have that in every Zoom, right? All right. Hey, I'm Mark Antonacci, the Executive Director of IC&RC, which is the International Certification and Reciprocity Consortium. I'm currently living in a town called Harrow, Oklahoma, which is right outside Oklahoma City. I've been in the behavioral health field from about 2000. My first 8 to 10 years as a counselor, and kind of let my certification go to get my MBA. In the last 11 and a half years, up until probably 2 years ago, I was the executive director of the Drug and Alcohol Association in Oklahoma, and now I'm the last year executive director of IC&RC. We create exams to protect the public, which are competency-based exams, which are psychometrically sound and legally defensible. We have 5 different exams. They're updated every 5 years. 2 are in substance abuse, 1's in criminal justice, peer recovery, prevention specialist, and clinical supervision. We're in over 47 states and 11 countries that use our exam. So we're definitely looking at data all the time. So good to meet everyone.
Thanks, Mark, and welcome. Next, we're going to go to Pete Nielsen. Pete, take it away.
All right. Thank you, Jeff. And my name is Pete Nielsen, and I'm President and CEO of CCAP, California Consortium of Addiction Programs and Professionals. Say that 5 times fast. So I'm coming to you live from the West Coast. So anybody that's Californian in the house, whoop, whoop. All right. So what we do is we're the association for the addiction professionals in California, the addiction programs in California, and the consumers or the people in recovery or seeking recovery in California. So I'm excited to talk about data, and I'm excited to be with you all. I have a bachelor's in business and a master's in psychology, so which makes me a danger in lots of areas. So I look forward to this presentation.
Pete, we're glad to have you with us today, and let's move on to Brianna. Good afternoon, Brianna, or good morning, depending on where you're at.
Yeah, I'm East Coast, so I am Fort Lauderdale. So I am an optometrist who also has a private practice and co-founded 2 technology companies surrounding this information that we're all sitting on in our practices to better serve our patients. One being Doctor Contact Lens, that helps patients easily order their contact lenses from their doctor. And then also Techify, which is helping startup companies get out into the market in helping them connect with doctors and make that sales cycle a little easier for practitioners to adopt technology for their patients. So excited to be here.
Certainly glad to have you with us all. Just
Rob?
a little housekeeping before we get started is as we go through, all attendees will be muted for the duration of the webinar. And not just when not muted, we get a lot of background noise and things, but we will have an opportunity at the end to ask any questions that you have, and so we can answer them as best we can. So please, if you have questions, hang on to them. If you want to change your audio device or adjust your volume, click on settings. We do want your input. We want to know what your opinions are on things. Polls will pop up on the screen. We have 3 of them. Click your answer to submit, and please feel free to comment in the chat. And if you have questions moving along, use the chat function if you don't want to hold on to them, and we'll answer them in a QA session, or if necessary, we'll do it in email after the webinar. So let's kind of get started. We recognize that data is becoming one of the biggest assets in healthcare. And we see an increase in tech. And I actually just had a call the other day with somebody who has a brand new wearable device that helps us provide outcomes. And using that, and telehealth is on the rise. We do recognize that simply collecting patient data itself won't impact outcomes. To improve outcomes, we really need to analyze, interpret, and act upon the data to make positive change. And we're glad to hear as our expert panel discusses how they utilize data to better the lives of their patients and how data help them create a more efficient and productive practice. Starting out, let's look at our first topic. And Brianna, let me ask you to start with this one. And gentlemen, I'm certainly going to want you to chime in your answers, but what kind of data are you capturing?
So running a practice, you have to obviously be HIPAA compliant in any data that you're collecting. So we're getting patient demographic information. Cell phone is super key, especially with any amount of follow-up that you're doing. An email address, right? All of us have so many unread emails. So when you're collecting data, the cell phone number is super key in running a business and keeping in touch with your patients. And then we also are collecting what medications they're on. And we have, are they smoking? Are they doing other things? Are they diabetic? So in an eye exam, you're collecting a lot of information that you're using. And then also along with the prescription information, whether they wear contacts or glasses, let's say they have glaucoma or macular degeneration. So all of that information is aggregated in an electronic medical record that we all had to adopt in 2011, 2012. So it's interesting now as EMRs have come out that none of this is really aggregated correctly, because you'll go to a dermatologist, you'll go to an eye doctor, you'll go to your diabetic doctor, and none of our stuff talks. And it's really hard to get reports out. And so I think that's where EMR started, and they've kind of failed on what their vision was for the future of aggregating health information. So it's been interesting to see how that all develops.
And I have a couple of follow-up questions. One is looking at the way EMRs are created. One of the struggles, and if you have the same struggle, please let me know, is being able to draw the data on the parameters that you want. If you were looking at certain demographic, what county of the state they live in, you want to get that information. Are you able to do that with some of the EMRs? That's been a struggle for many people.
It's been a struggle. You can get some information out, but you can't really do anything with it. And what EMRs have done is they've really locked down their softwares. So in building something like Dr. Contact Lens, where we're able to go in and report some of these things and then do something like a simple reminder to a patient for an appointment, or a simple reminder to order their contacts, the EMRs are holding patients in practices and doctors hostage to their software. So there's no vision for them to integrate with outside companies. So if you think of it, it needs to be more like a Salesforce model, or even an Apple model, where they opened up their systems for people to come and build on top of them, because they just don't have the wherewithal to build something that's an add-on service. So it's interesting, what's really driving the complication is the EMR is trying to hold the information when it only belongs to the patient. So we as doctors house the information, the patient owns the information. So it's interesting on who they think is the owner.
And the EMR is designed to protect the information, not necessarily share what can be shared, what is not confidential, to help increase sales or draw new patients in.
Exactly.
Thank you. Pete, let me ask you the same question.
Thank you, Jeff. So I'll tell you two areas. One area is when we work in certification, we're always collecting data. And what I find is we don't use that data for the benefit of others. So for example, is if you're certifying individuals, who are you certifying and are they matching the patients or clients that they're serving? And so what we're finding is that there's underrepresentation everywhere when it comes to who is the practitioner and who's being served. So we need to make sure that we represent the individuals that are getting into the profession or representing who they serve. It's important for people to see them, and say, oh, well, there's somebody that I can relate with, of that culture, of that ethnicity, of, and I think that or even that gender, I think that we're really lacking in the helping profession. And I think data can inform that. And I'm looking at how we can use that data to empower workforce development, to empower change, and so that we can get more, diverse as far as practitioners out there. I think that's key. The other thing that's really my passion project right now is in addiction treatment. There isn't one outcome tool or measurement that you can say that this is it. This is how we measure how patients or clients are getting better. And so I've taken a personal mission to look at, we need to get a data collection tool to be able to collect the data and then agree on the data. So the problem has not been the tool, it's been agreeing upon what data to collect. And so I've made a decision to really promote one type of set that I think is pretty, because the problem we've had is they say, oh, we should collect quality of life. Okay, so what a part of quality of life? And then everybody be all over the map as far as quality of life. So I've settled on recovery capital as being the measure, and really kind of not let abstinence be that data point that's most important. And over the decades, that has been the only thing that they can collect, and it's just unreliable. And I don't think it's necessary, because you can collect abstinence data or recovery data. I mean, you can also collect both together, but I really think that if you're looking at SAMHSA's definition of recovery, really got to look that it's broader than just that absence base. And really, when you're collecting absence data, you're not collecting quality of life. You're not collecting how they're doing or how they're getting better. So that's where I'm at with my passion project. And so data is just in my world right now, and so important.
And Pete, you and I being in the same business, one of the struggles is that two organizations can do the exact same thing, but not only do they may not, especially in behavioral health, agree on what data should be collected, but even if there was an agreement, how it can be quantified. There is no standard measure, and I think that leads to some difficulties that we need to look at in terms of being able to move patients from one provider to another, to seek appropriate referrals, etc. Now, Mark, you work in a larger scale with your clients are boards like Pete and mine. So what kind of data are you collecting?
Well, we collect a whole lot of data. I mean, data, tomato. It depends if you're from California or not. Um, we have to, make sure that our exams, we use a testing company. That's how much data we got to use to collect with psychometricians that help us collect this data. And we use data for multiple reasons. So we get a good diversity of professionals because we use subject matter experts actually will help us write the questions, review the questions, to make sure that they're still current. We don't want to have any new evidence-based practices come out there and then say, this practice is no longer warranted. So we have to pull the questions. So we look at geographic location, how many years in the field, and that's a big one. We like to keep, our exams should be on the lowest competency-based level. Someone in the field 20 years knows a lot more than someone than one. So we have to be real particular when we get these subject matter experts to help write questions, that the questions are not above the level of the person taking the exam. Race, ethnicity, gender identity, what country do you live in? We have 11 different countries. What part of the United States, Midwest, Northeast, Southwest? Where do you work? What type of possible other license you have, right? So we may have a professional licensing counselor, professional licensed counselor, or LPC, or an LCSW take our exams to expand the scope of practice. So we want to know where you work and what field, what population, and education, because a lot of standards are different. So we collect a lot of that data there just alone, and trying to get a good diverse population. And then we also collect data on the results of the exams. Okay, we need to follow up. Maintenance is huge in making sure that your exams are competency based because you need to maintain them. What's happening in people in California? Why aren't they passing the exam? But if someone from Connecticut is. Oh, that's not the personal guys either, by the way. But Pete's ignoring me. But yeah, there's just a lot of data that we have to maintain to make sure to see what's going on. Did we miss something? And all our data is very important. I mean, that's just the tip of the iceberg, Jeff.
And it certainly seems this might be the right time to put our first poll question up, to kind of keep us in line with what we're doing. So if we can get that first one up. So what we were asking of everybody is how much data are you collecting? And it's pick the one that best applies to what you do. As we get ready to jump into kind of our next section. And let's start with Mark, as he went last, and the last one is, what's the purpose of the data that you are collecting? Well, let me go back. I'm sorry, Mark. Let me go back because I jumped ahead a little bit. Let's look at some of the poll numbers on here. The majority of people or that responded had collecting a minimal amount and are looking to capture more. Nobody feels that they're capturing a sufficient amount, and 25%. One provider is saying collecting most to all possible data, and that's an interesting thing. And I'm wondering how much of the numbers add up to if we were extrapolate them. I know we're looking at a small sample here, and then a small group are collecting no data whatsoever. So I really appreciate you taking the time to answer those. And Mark, I'm sorry, we'll get right back to what are you doing with the data that you're collecting?
Well, I was going to answer a little question. Looking at that survey, it intrigued me and it reminded me is, data can be collected. You could put surveys out there. You can collect all the data you want. The key is not just is the data that you're looking for, is it, and maybe Brianna can help us out here on this because I'm thinking it may relate to you a little bit more. That it needs to be easily accessible and easily for the person to do. Otherwise, if it's a chore, if it's a 4-page, I'm not going to fill this out. I mean, my day is busy. I got emails, I got texts. Now I'm going to fill out a survey for who, So it's not just collecting the data. It's you really got to look at the avenues of collection to make sure that it's something that people will do. And then the other, of course, point is when you're collecting the data, make sure you are collecting the data that you can use. I remember doing a survey for 3 years when I was running the first 3 years of my journey with the Oklahoma Drug and Alcohol Counselors Association. We were collecting this data and I put it all together and I'm like, what? I can't do anything with it. I never really looked at what we were doing. I had to redo the survey and actually collect the data to find out what's most useful. But to answer your question, our data, it really needs to be a good overall, I hate to use the word average of what the whole country is looking at and what they're doing in order to make an exam go across different states and country lines. And, you know, and our biggest challenges are some of the international countries that use our exam, because now you're looking at language barriers. You know, we collected data and we did decided to say, hey, people wanted to take our exam in Spanish. So at one time, the company converted the exam to Spanish because the data says, hey, people will help out people who speak Spanish to pass the exam. And it turned out to be the opposite, since they were taught in English and studied in English. When the exams came, the dialects, we ran into problems. So our data has just got to be almost like perfectly captured in order to get that diversity, because there are biases when you collect data, and that can always, lean your data to a direction that may not be true.
Brianna, Mark had referenced you with what he was saying. You want to chime in and talk about what you do with the data?
Yeah, so what we do kind of at a practice level is look for trends that are happening. So if let's say myopia or nearsightedness, we know is on the rise in kids, and we want to target moms between the ages of 30 to 45 that we know would have kids. This is where you can do interesting things with marketing to a practice to actually help with preventative care. So in the healthcare space, nobody's really about preventative care, right? They want you to be sick. They want you to come back. So we can be more proactive in looking at the information. And let's say that there's a piece of equipment that I want to purchase. What form or what data set can I actually use that on? So am I making the purchase because I actually want the instrument, or am I making the purchase because it's actually going to help the patient demographics that I'm serving? So you can really go into this in all subsets. And it's interesting, in an optometric practice, there's about 7 or 8 pieces of equipment that I have, and none of it talks, which is really interesting too. So if you look at from a patient form online, aggregating that into your electronic medical record, how many times as a patient do you go to a new doctor and have to fill out this form that's been copied 30 times? You can't read it. The doctor never looks at it, right? All of these are systems to become really patient-centric. So now my staff has to spend 5 minutes entering into a piece of equipment, first name, last name, date of birth, patient modifier, where all of this could be flowing through the practice more easily to help speed up a process also. So it's interesting as companies are coming out that they're not looking at the ease for becoming a patient-centric practice. So I see the future along the lines of here, really our health records are all going to be living on our phone, right? So when you're traveling from doctor to doctor, you're not having to print out a report and carry that with you. Your doctor didn't get it. So that's the information, especially with like diabetic patients. There's 5 points to an exam that a diabetic has to have in order for a primary care doctor to get paid all the way through managing that diabetic patient. And if they're missing one of it, they don't get paid. And so this is putting a lot of hindrance on our medical system, because it's leading to a lot of physicians not getting paid for performing a service. So data is really important for everybody, from the patient to the staff back to the doctor, for that whole mechanism to work
Yeah.
in the healthcare system.
I know I'm very lucky because I have all my medical health care under one hospital system. And when I go to an appointment, all the person says is, has anything changed since your last appointment? Not necessarily with that provider, but I can say, oh, this medication changed or this happened. That I don't have to go through all of that. And I can make any demographic changes on my phone,
There you go.
which is nice.
I got a question for Brianna real fast. When you collect, how much data do you have to collect for like reimbursement insurance and stuff that really has no use for you at all, but you got to collect it in order to meet requirements?
A lot of it's just patient demographic information.
Okay.
So they just need a simple diagnosis code most of the time to get anything
Mhm.
submitted. And so vision is interesting because you have a vision discount plan. So, and then you also have a medical plan. So if you have a medical diagnosis, you need different things to submit to a medical insurance, and then you need different things to submit to a vision plan payer. And so it's interesting on whether you need the, last four of a social, if you need the whole social, if they actually have a patient ID information. And so that's all interesting on the front end to make sure that we get paid also to know what the patient has for coverage.
Yeah, that's what I thought. That's very,
So
very.
let's go to our next question. What kind of data are our viewers? What are you capturing? Are you capturing demographics, EHR data, administrative data, sales or service data, or just very simply, you just want to increase the type of data that you're collecting? You can select all that apply to your work. So do we have the data? Do we have it looks like everybody is collecting EHR data, and the majority are collecting patient demographics. So nothing there in administrative, sales, service or sales data, and no responses to wanting to increase the type of data that people are collecting. So as we kind of move on to our third area to discuss is, and Pete, let me start you with this. How are you using the data that you collect? How are you specifically using that? If you have examples.
So, it's funny because a lot of people say about collecting data, and I find that people collect way too much data and they use very little of it to inform their decisions. I tell you that, many times I would think I would know the answer to a solution because I have experience, because I know industry practices and all of these things. But I'll tell you, when I let the data speak, I sometimes change my decision that I'm going to move forward in. And so here's an example. We were getting lots of complaints about customers unhappy, and it was taking too long. And so we would get all of these anecdotal reports. And so I was responding to those reports and changing my practices, but I wasn't looking at the data. So then I decided, you know what, I'm going to pull the data. What does the data say? What's the average time that it takes to do this for an individual? What's the average time that it takes? And I was finding that I was actually meeting my limits that I was setting, and what was expected as far as business practices. I was meeting that. So what was happening then? Well, you get a couple people that decide, that it's taking too long for them, and I may be acceptable practice for time, but it's taking too long for them. So then they tell 3 friends, they tell 4 friends, and then what happens is I then have a public relations issue that I can actually fix that with data. And I can say, this is the data. This is how long it takes. this is what's going on. And I was able to actually get in front of that issue that was, could actually be a worse PR nightmare if I didn't have the data to actually inform and actually educate the consumer as far as this is what it is rather than, and, I don't know, it could have been started by one of my competitors of, they could have been the one that, did Google review and say, hey, I don't know, I'm just joking in that sense, but you just don't know. So that's why data is so important, because it helps us to inform, and we want to make sure that we are intentional about the data that we collect and then use that data. I'll tell you, when I was working in running treatment facilities, I find that there was so much data that was collected and very little of it was used, especially about individuals that come into the facility. Who's coming into your treatment facility, and where are they coming from, and what language are they using? What's their gender? What's their culture? And are you using that to inform your decisions on care, or using it to inform how are you attracting individuals to come to get treatment? And are you using that information to inform your marketing practices, your advertising practices? Are you, I find more often than not, people go with trends. And so it was really in addiction treatment, everybody wanted to do AdWords, but you got very little return on the AdWords, but everybody wanted to use it because their competitor was using it. So they were just using it, but they weren't looking at their return on investment. Same thing when they were doing marketers. But when you look at the data, that changes your behavior, because if you look, what are you getting the return on your investment for, and what's actually the best bang for your buck? And I tell you, when they started looking at their data, they changed their practices, and because they're better informed.
Brianna, same question to you.
Yeah, so I built a whole concept around this with Dr. Contact Lens. So in the EMR, if I am prescribing a contact lens that's best for that patient, and then they order a 6-month supply, in 6 months, every other person in the universe is reminding that patient to order their contacts except for where they got them. And so what we're trying to do is connect back a contact lens prescription back to their doctor, which then connects their health. So we know if a patient leaves, they are at a higher risk to developing an eye complication related to that, because they do become non-compliant. So living in an optometric space where we have patients and then we have consumers, it's really interesting on also patient perspectives as well. So when someone is prescribing that to you, is it in your best interest? Yes, it is, right? That's the ethics that we all live by. And we want to make sure you're getting the product that we're prescribing. So for instance, macular degeneration is on the rise. We know by taking an eye health vitamin that can actually be preventative. What we're interesting is patients will be compliant on one bottle, but they'll never return to order anything else. And so it's looking at information within these practices to market to your patients, but take it a step further, enabling them to order. So as Amazon is getting behind this with One Medical, right? Same thing, if you're prescribed an eye drop, why are we sending you to another pharmacy to get it? Why? People want convenience. They want things on their time. They want things shipped to their homes. And so it's interesting living both on the sales side of selling to doctors and not them not understanding the data that they're sitting on, but giving it away for free to other companies to use it is just blows my mind every single day.
When you talk about the convenience, we are in a one-stop shop kind of world right now. And I think that only it works for marketing. It also increases compliance just to get a note to follow up. But the fact that people can access everything from one spot, everything that they need to do, I think is fantastic. And it's one of the great things by having electronic. We just got to be able to make it work better on a grander scale. Like you said, there's some that do it. And I don't want to get egged by saying anything good about Amazon. these days with Jeff Bezos. But I think that's one of the companies that's really taking advantage of that.
Yeah.
Mark, you want to jump in? You got to unmute yourself, bud.
Okay, that's twice today. Just wanted to add in is that I remember a lot of times we create data, but we don't experience actually filling out the data. And if I remember my treatment days working at treatment facilities, I would go through as I was a patient from walking in the front door through all the steps. They used to call them a walkthrough, do a walkthrough and try to figure out how does that customer, how is your policies or your data that you're looking for, how does it feel to fill out a form with your name on it and then put your name again on 7 different forms, right? It's very frustrating. So doing walkthroughs sometimes will give you a better ideas. You know, is your data collection painstaking to the person who you're trying to get it from? But for IC and RC, we spend a lot of time collecting data on pass and fail rates. So this is really simple. You either pass the exam or fail the exam, because we don't want that exam to be too easily and we don't want it too hard. We want that exam to be in the perfect spot to show true competency. So the data is easily collected, but now we have to look at individual states, individual countries, and try to dig deeper and look for more data. Trying to look at the standards, maybe why is one state have a 33% pass rate and somebody else is 65. So it leads us down another avenue of collecting different data and trying to find out what's going on. Is it the exam, or is it the study materials, or is it the education? So there's a lot of different areas.
Great, thank you. Let's jump on to our 4th topic to discuss. And another important one is, how do you take that data and translate it so you can actually improve your outcomes? Brianna, let's start with you.
Yeah, this has become really interesting. So again, I think it all comes down to compliance with the doctor. I can't tell you how many times a patient will sit down on my chair. I tell them to do XYZ. I'll see them a year later, and then there's no follow-up, right? So part of that's on me, where I haven't been able to connect with that patient on an ongoing basis. But also in the future, we have to improve these outcomes, or we're going to be in a world of hurt, right? Diabetes, leading cause of blindness. If you know that these patients are not coming back for their annual eye exams, this also is going to lead to issues. So the more that we can translate the data into improving the outcomes in follow-up care, and if they do miss an appointment, then we can follow up with them, it's not like a person following up with them, it has to be through automation, right? So you're going to scale a practice through clicks. You're not going to scale a practice through more people. We're all out of space at this point, but we have to see more patients than ever to make the same amount of money that we did a year ago. And so that's just the world that we're living in. So when better outcomes lead to better treatments, that's going to improve the healthcare and it's going to lower healthcare costs. So if you're jumping from practitioner to practitioner, doing one test here and the same test here, that payer is paying twice on that. So we don't have really anything that can travel with the patient yet. So I think in doing that, we can really, really get healthcare affordable if data starts talking for the patient's behalf. So all of it is intertwined.
Yeah, it's not just a simple in separate boxes. The boxes are all kind of mixed together and figure out how we're going to translate and use it. Mark, jumping in.
Sure. One of the big things that in the substance use field, retention, good pay, and the career ladder, right? But the one I want to focus on here is retention, as far as IC and RC is concerned, is we can get the data and we can see what exams are increasing and are decreasing over a long period of time, since we've been around since the late 70s. So if there's an exam, and we're looking at one now, our prevention exam, for some reason, it was on an upcline for the last 3 years, has been on a decline. So this data now is making me look to just a simple data collection of pass and fail again, and entry level, how many people taking the exam versus how many people took it the year before, and find out why there is a lack of interest. And it could be laws and policies have changed in certain states that prevent people. But I don't want to continue to wait till say we had 1,000 people take the exam this year, and that next year's 900, 800. I don't want to wake up when it's 400 and go, what do I do? By then, that exam is probably done and over with, because something must have replaced it. So we kind of keep an eye on the retention. What is sparking people to take our exams, and so forth, to see what has changed. So the data actually leads to another avenue of collecting more data, which is usually the case, to find out what's going on. But we definitely want to make sure that we are retaining individuals and that our exams are still being used and up to date with the current field.
Great, thank you. Pete, how are you translating the data out there in California?
So one of the things I see with data is that sometimes when we collect data, we have missed opportunities. And because sometimes we think that a data set it doesn't reach the sample size, it doesn't capture, and sometimes we throw out that data. And I've been challenged to start looking at what are the data that I'm throwing out, and am I throwing out the wrong data? And so I've been challenged at looking at, okay, what am I dismissing in capturing data? Is there areas where I didn't think that was an important data set to collect, and maybe it's one of the most important, so that's been something that I've been looking at and seeing, especially with health disparities and who are you not capturing? What is it? What's not there? Here is what you have, but what are you missing in that? So when you look at the picture, it's kind of like that puzzle piece. When you look at it and you have all of the pieces, but you've somehow lost the one last piece to that puzzle, it actually paints you a different picture. It gives you what is the piece that you're missing. It actually gives you a great picture of the piece that you're missing, so you can go look for it. And I look at that as well, is some of the things that I'm looking at now is what are the pieces that I'm missing, and using data to inform those what's missing, to then be able to then fill in that gap or collect that data.
Let's jump in and put our final question up our last poll question before we jump into our final topic of the day. So how are you using your data? Please select all, or use it for marketing, sales efforts. Are you using data to improve patient services, improve efficiency, or are you feeling you need newer, better tools to help use the data? And what we're seeing is improving patient services, improving efficiency. We're seeing everybody is using that in marketing. And about half of our answers are about sales efforts and using new and better tools to help use the data, which leads us in, that last statement leads us into our final question is, when we look at it, how do you use tech to help collect and use your data? Pete, we'll jump in with you.
So actually, I want to use an example of when I should have used tech to collect data. So I used to be in private practice, and I was seeing a lot of different clients at the time. And finally, it started dawning on me that I was seeing some similarities in different client groups. And had I been tracking the data, I probably would have come to the conclusion sooner, because once I figured out, that, the picture that was being painted for me, I started changing my marketing practices. There's two groups that I was attracting, and I didn't know how or why. But then, when I dug into, the data and looking at it, and it could have been faster with tech, because tech could have pointed a picture out that which took me months. It could have pointed out in days. And that was, I was attracting well-to-do family members to my private practice that were typically family businesses. So I was attracting a lot of family business. So it happened, that the heir apparent to the family fortune had an addiction problem, and the family was like, "Do we want to leave our family business to somebody that has an addiction problem? That might be a bad idea." So I was finding that this was a demographic that I was, and the other one was atheists. My practice seemed to, overnight, 50% of my practice was atheists, and I hadn't, it wasn't anything that I did in my business practices, but it was word of mouth, because I treated people with dignity and respect. I didn't force anything upon them, and I just did what you should do as a clinician. And I'll tell you that those two things changed the way that once I found out that data, I started changing how I marketed, advertised, how I set up my practice. And I wish that I had collected that data, and I wish that I had some electronic means, because it would have made it a lot easier and faster if I had that tool to be able to collect that data and then be able to, put it together, and then tell me a story, So
Thanks, Pete. That really was good, and a good explanation of it took the question in a different way, but answered it nonetheless. Mark, what do you got?
A lot of surveys, a lot of digital stuff that we send out. Technology is really good as far as if we can get people engaged. So we need to do a survey, gathering subject matter experts to give their information for 5 or 6 different times through the entire process of an exam. That can create an exam anywhere from 8 to 12 months to create an exam. So we have different areas of where do you want to be in a person? We have two in-person meetings, or there's a survey and there's data collection, and we kind of get their input into where they want. So we use the technology to figure out, once again, leading back to getting them to participate where they want to. And that's the key. And I kind of do this on a personal level, not so much for data collection, but for communication. Like I may ask Pete, how do you like to communicate? He goes, don't call me, don't email me, just send me a text. Jeff might want phone call, Brianna might want an email. So trying to figure out those avenues is real important. But any kind of data that can be done electronically that actually gathers that information will save you a lot of time and effort. And, QPR codes are huge, big now. You used to have surveys at conferences where how'd you like the speaker? How'd you like the venue? Now you do a little QPR code, it tallies everything for you. Whatever I
So
can
tech
find.
is certainly making it easier for the ICNRC.
Oh, for sure.
And Brianna, to bring us home, yours, how do you use tech to collect and use the data that you seek?
Yeah, so I think in most of our practices, we have really leaky buckets. And so using technology to help fill these leaky buckets is really critical. It's going to lead to better retention for our practices. It's going to, again, lead to better outcome. It's going to create efficiencies within a practice. So, across the US, practices are operating over 100% of capacity on 70% of their staff, which is a huge issue right now. And so really, when you're trying to scale a business or scale a small practice, you're going to have to create this within your EMR and with add-on services. And it's really goes back to being patient-centric. We're doing all of this to create an integrated experience that makes it both efficient and convenient for a patient to get the help and the treatment that they need in order to live their best lives. And so I think when information or when data points or tech comes in, they're starting with the wrong user in mind. A lot of the time they're starting with the doctor in mind when we have to start with the patient in mind and how they're going to go through a process. So that's where we have to get better to keep patients engaged and keep healthcare moving forward.
Thank you. I think that's a great way to kind of finish up our questions and talk about the focus as always has to start and really end with the client. The data has to help them either make it more convenient or seek the outcomes that they want. We can grab a lot of data that we can use for marketing things, but we have to remember that it begins and ends with the folks that we serve. Thank you for that. Do we have any questions from any of the viewers?
Nothing is submitted through on the chat so far.
Well, seeing that we don't, I want to thank everybody. Thank you, panelists, for your time today. Thank everyone that was here. And thank Lead Squared for giving me the opportunity to do this. And let's go to Nick.
Hey, thank
It
you
looks
so
like
much.
we should- One
Yeah.
question.
Sorry, Mark. Yeah, I did see a question pop up as well. So
Oh, I'm sorry.
let me bring that up first. Violetta says my parents would need a dedicated caretaker or a personal assistant at this age in order to keep up with all the exams that are being recommended by their PCP. What would you recommend to other specialists, i.e., cardiologists, that will need to work together in order to truly take care of patients in order to ensure the patient keep on track? My dad has missed his eye doctor appointment for 6 months. Brianna, do you want to take that one?
Yeah, I'll take this one. So I'll just kind of throw in here just my own personal experience. I think that a lot of this comes down to patient reminders and pre-setting appointments and keeping up with those if they miss something. So when I was pregnant and I had an advanced maternal age where I had to go to multiple physicians during my pregnancy, and the thing that really kept me in line is we get busy, which means we miss an appointment or something's not fully scheduled. So what kept me in line was literally the reminder about 2 hours before the appointment. So it gave me time, if I forgot to put it on my calendar, it gave me time to move something around so I could go to the appointment. So I think it's critical that doctors are reminding their patients. So missed appointments cost the healthcare system over $150 billion a year. And so just having a full appointment book is critical, but having patients come is even more critical to the system. So I would just highly recommend, just make sure there's some automation here with appointment reminders.
And that's a great segue for me to just also chime in on that. I think that's one of the areas where we at Lead Square are also encountering, based on the different conversations we are having with practitioners, owners of different small clinics, that the show rates of patients actually coming in, like they want to call and schedule an appointment, but they end up missing it for some reasons. And because the clinics are so overwhelmed with already pre-booked appointments or walk-ins, they don't have the bandwidth to sort of remind or to make phone calls or do any kind of those things. And that's where Lead Square as a platform sort of becomes really helpful, is because we help you set up those automations and those workflows where you can actually send out these reminders to patients 1 day before, 2 hours before, 1 hour before, and give them the option to reschedule in case they're not able to move around their calendars, to definitely be able to also request a reschedule. So yeah, I think we don't really have any other questions. Obviously we're almost on time. I want to thank everybody on the panel for taking time, joining us, sharing your insights, your knowledge, your experiences of how you leverage data. Anybody who's interested in knowing more about how Lead Square can help you manage this data across your different platforms, different technologies you use, and just from how you can manage data coming out of your EMR, we'd be more than happy to engage and give you guys an insight of how we are doing that from a reporting and capability standpoint. Finally, thank you once again. Have a great rest of the week. Happy holidays, and we will see everybody soon. Thank you.
Thank
Have a
you.
good day.
Goodbye,
Thank
everybody.
you. Take care.